or 90. I don't know about you, but when you go outside, especially on a hazy day like that, do you start squinting? I wonder if that means you need glasses or at least sunglasses. And what are the good ones? What are the bad ones? We're going to look at summer, sun, and vision now with Dr. Sam, Dr. Sam's Eye Care in Claremont and in Hanover. Dr. Sam, first of all, how you feeling?
Good morning, John. Great, thanks. How are you?
Good. Because I know you had a couple of those kidney stone problems. As someone who suffered from kidney problems, boy, there's nothing more painful, right?
You've had that too, huh, John?
Well, I actually had my kidney taken out, and it was like, whoa. And I guess I was equating it when we were talking about, you're not feeling well. If there is a male version of natural childbirth because of the pain, we can only imagine what women go through. That would be it.
Well, maybe this gives us an idea.
Yeah, I think so. Well, listen, let's move from kidneys to on a day like this when you absolutely need sunshine, need sunglasses for the sunshine. We spend a lot of time, of course, worrying about sunburn, and we put sunscreen on, and there's so much focus on that, but we don't think about our eyes. It's a crazy question. Can your eyes get sunburned?
Of course, yes, they can, John. Just like your skin can get sunburned, and we're all familiar with that feeling of going out on the beach for a day and without any protection on our skin, and what happens as a result, right? We get the red, hot skin, and it's all the classic signs of inflammation when the skin's been damaged by the sun. Sorts of things can happen to your eyes in various ways too.
So how do you, just regular sunglasses? Well, you can't use just drugstore sunglasses because you need obviously UV protection. What are the good sunglasses? What are the things I should look out for?
Well, that's a really good point you bring up, John, about regular sunglasses that you'd buy at the drugstore or places like that. Interestingly, you do get very good sun protection from almost all sunglasses. You don't get as good optics. If you're looking for something that'll give you good vision, not give you hazy vision, keep things nice and clear, and keep colors true, then you'd want to get a better pair of sunglasses. But interestingly, it's pretty tough to find anything on the market anywhere that doesn't give you good sun protection. Most of them are made of polycarbonate, the cheap sunglasses, and that material all by itself gives you very good sun protection.
Okay. If I do get sunburn in my eyes or the sun is affecting my vision in some way, shape, or form, what are some of the long-term problems that would result from that sun exposure?
Well, lots of things can happen. We don't always take good care, and especially you and I know when we were kids, back a few years ago, these things weren't understood very well either.
Right,
it wasn't
right.
like everybody understood that you should take care of your skin and protect your eyes. As it turns out, the eye story is very similar to the whole skin story. Lots of effects, pretty much all preventable by taking reasonable precautions. You get the short-term effects. Longer-term effects are wrinkly skin around your eyes. The eyelids can be affected. There are a number of skin cancers that are very commonly appear around the eyelids and on
Really?
the eyelids. And that's one of the biggest reasons right there to have good protection there. You're not going to put sunscreen on your eyelids because
No.
it'll get in your eyes. So you need to wear sun protection for that. Sunglasses, of course, and a hat with a brim is a good thing to do too, if you can wrap your mind around that.
Yeah.
But long term, there are also, you can get these what we call pingueculi, which are these little yellow bumps on the white part of your eye. You see these on people pretty often. People who've been out, sailors and people who work outdoors. Farm workers often get these. They can also creep onto the cornea and become a big problem. Cataracts are more common in people who don't use sun protection and are outdoors a lot. And retina problems, age-related macular degeneration, and certain inside the eye cancerous tumors occur more frequently also.
And that's from exposure to the sun. Wow.
From sun exposure, right.
Now, if I get, what would I look for on my eyelid for skin cancer?
Any little bump
Okay.
that has changed, anything that seems to be growing, you should have looked at immediately. Good idea to have somebody just take a look at you every year or two anyway, just to make sure with magnification we can see things a lot earlier than you can just looking in the mirror. But anything that's on or around your eyelids, or really anywhere on your skin, if you see any growth, you should have somebody take a look at it. Normally, if it was on your eyelid, you'd probably go to an optometrist or an ophthalmologist for that. Anywhere else, you'd be more likely to see a dermatologist for it.
Got it. Dr. Sam from Dr. Sam's Eye Care, Claremont. And in Hanover, we are talking about summer eye protection beyond sunglasses here on WNTK and WUVR. And eye examinations now, you can actually look right into the eye. It's almost like a 3D examination.
Sure. We have new ways of doing that, too. There are much better instruments now than there were even just a few years ago, commonly used for being able to look at inside the eye in great detail. For the most part, the most important thing is that you get a good view with good magnification, which we've been doing all the time for the last 30 years. It's that's not really new. A lot of people have what we call nevi, little freckles inside the eye that we like to watch to make sure that they don't turn into something that's growing that needs to be addressed. Most of the time they don't. We watch them and make sure occasionally they need to be addressed.
Wow, all these things you never think of. Dr. Sam from Dr. Sam's Eye Care here on WNTK. When you were talking about protecting your eyes from the sun, and we use the analogy of we spend so much time with sunblock for our skin, and I was thinking of folks with light-colored skin who are just more susceptible to sunburn. Is the same thing true with their eyes?
That is true. That's a good question, John. That is true with respect to eyelid problems. People who are very fair are much more likely to have problems with that, just like they are on the rest of their skin. People who are naturally darkly pigmented and suntan easily, or are darkly pigmented just to start with, have less chance of having any problems there with growths, cancerous tumors, that type of thing. Inside your eye, it really doesn't make much difference. The media inside the eye, the lens, and the tissues inside the eye have to be clear, so it doesn't matter what race you are or how suntanned you are. The risk of getting a cataract or macular degeneration goes up about equally between the races, although age does make a difference in a lot of cases as to sun exposure. Kids are more susceptible to sun damage. They don't. People typically don't show any problems until midlife or later in life, but it's thought that a lot of the damage occurs in childhood.
Really? So if I'm sending my children out to camp, give them some sunglasses.
That's a great idea. And also, of course...
And how do I know if they're going to use them?
Right,
that's the other thing.
You got to have them wear them, right.
Yeah.
And of course they should use sunscreen too. I mean,
right.
It's all the same concept.
Yeah, definitely. Now let's say I'm working on a summertime tan, and a lot of us lie out in the sunshine. When I'm putting obviously the sunscreen on, and I'm just lying there, and there's the sun beating down on me, do I wear my sunglasses or keep my eyes closed? What do I do?
Sunglasses are very helpful in that situation. Of course, you want to be reasonable and limit your sun exposure. It's just not good for folks to get dark suntans. It's not good for you cosmetically over the long term.
Sure.
People get very wrinkly and craggy looking when they get older, which you're trading off perhaps good looks in your youth for bad looks when you get older. It's maybe not a good trade-off.
No, it isn't.
But also it's important to take care of your eyes that way too. You want to be sure that you're not doing anything unduly stressful there.
And stay out of direct sunlight, middle of the day, that kind of stuff.
Usually people say 10 to 2, 10 o'clock to 2 o'clock is the worst time. It's true. You want to be sure that you're well protected during that part of the day.
If the sunglass is dark, because I've had different kinds of sunglasses, and will now come to Dr. Sam's Eye Care to get mine now that I know so much more about sunglasses. Some of them have been kind of amber, and it's like, oh, this is nice, but some of them have been like putting on blinders. They're so dark, and I'm thinking, well, because they're dark, they're probably blocking out more sun, and I don't know which one is better.
Yeah, it's a good thing to use a fairly dark tint.
Okay.
You don't necessarily need it to be very dark as far as ultraviolet light protection and protecting your eyes from long-term sun damage. If you think about it, a lot of people never use any sunglasses.
Right.
They have higher risks of problems, but it's not like they always have problems. If you're blocking 90% of the light, you're doing pretty well.
So look for look for that. That kind of makes sense. Come to think of it, and the other thing that I never thought of until you mentioned it, and it's like, oh yeah, the sunglasses that change the color of things. Do I watch out for that? Are those the sunglasses that are not quite as good as the better ones that, keep the colors uniform, whether or not I have the glasses on?
In general, you'd like to look for just a gray tint that will not change colors.
Okay.
Right? If you a lot of sunglasses have a brownish tint, and that's okay. It makes things look a little bit redder. Generally, it's not enough to change the color of, say, of a traffic light, so you're not going to run into practical problems that way. But most of us want to keep colors fairly natural as far as this goes. Yeah, you reminded me of when I was a kid, John. I got all my medical advice from a relative who was 3 years older than I, and I can tell you that when you're 8 years old, an 11-year-old has the wisdom of the ages.
You're not kidding.
And the advice I got was at the beginning of the summer, you go out in the bright sunlight and take a day on the beach and get a beet red blistering sunburn, and that would protect you for the rest of the season. So that's what we did.
Yeah, exactly. Same thing.
It's not what we recommend these days. I mean,
no.
Of course, these days we know that having some severe sunburns when you're a child is actually a large risk factor for various skin cancers. So.
Sure.
But funny the way things change, huh?
Yeah, it is. And so generally speaking, whatever caution you take for your skin in bright sunlight on a day like this, or with all of the great weather we're going to have all the way through the weekend, you're going to take those same precautions with your eyes.
That's the bottom line there. Just if you're going to be out in the bright sunlight, use your sunscreen and wear your sunglasses.
There you go. Simple, straightforward, common sense from Dr. Sam. Dr. Sam's Eye Care in Claremont and in Hanover, and online at drsamseyecare.com. You have the most calming voice. Can you just come in every day and calm us down?
Thanks, John.
He does, doesn't he? I just love his voice. Dr. Sam, always a pleasure. We're glad you're feeling well, and look forward to having you back again soon.
Thanks, John. Great talking to you.
There you go. Some common sense tips from Dr. Sam and Dr. Sam's Eye Care. We'll try to get, Dr. Sam has a number of tips here. Let me see if we can get them up on our Facebook page for you a little bit later on, along with the contact information for Dr. Sam and Dr. Sam's Eye Care in both Claremont and in Hanover at 9 Dunning Street in Claremont at 543-2020. Of course, that's the number, 603-543-2020. And in Hanover, right behind Yama, in the same building there on Dorrance Place in Hanover, Dr. Sam's Eye Care in Claremont and Hanover, and online at drsamseyecare.com.